We just spoke with the one and only Dougie Fresh about his new campaign to get people to wash their hands and practice social distancing. He also, Fred, dropped a beat on us.
He did drop a beat on us.
Proven he is untouchable. I mean, he is amazing.
He has lost nothing.
Absolutely,
off his fastball,
yeah, he's great. And so wonderful that he is taking his talents and his time to help help save lives in this terrible pandemic we're facing.
It's a great collaborative effort and a great message. And joining us now, part of that effort is Dr. Olajide Williams, who's Chief of Staff, Department of Neurology at New York Presbyterian Columbia University Irving Medical Center. Welcome, Doctor.
Hello, thank you so much for having me on.
Dr. Williams, first tell us how this partnership all came together.
Well, you know, Doug and I have been, we started Hip Hop Public Health actually almost more than 10 years ago. It was interesting the way we met, but I think I'll save that story for another day. But we basically connected. We had a very strong intellectual and spiritual connection around the issue of health disparities and closing the gap that we continue to face in society. And I thought it would be a good idea to utilize hip hop as a health communication tool that could be used to really try to close the education gap around health literacy. And so we started doing that, you know, a very long time ago. We found that the model we had created, which really brings his iconic hip hop talents, and then I try to bring my scientific and public health expertise to the table, and we merged those two things, and we started creating programming for communities of color. And our programming is really focused on empowering the youth with key knowledge and information, imparting behavioral skills, but also motivating them to change behavior. And so when COVID-19 pandemic sprung on New York City, you know, I was on the front line treating COVID-19 patients, and I realized that we have to take the fight, you know, into the community. This is such an infectious virus, so contagious and so easily contracted from surfaces and from the air. You know, a lot of people don't realize that we touch our faces 23 times an hour. And if we're touching, you know, surfaces that are contaminated and we're touching our faces so often, you can see how easy it is to contract the virus. And so we thought it'd be important to really begin with some very simple basics, and that was hand washing. And how can we really communicate a strong message to our communities that empowers them to take hand washing seriously and to show them the proper technique for hand washing. And we think that is a life-saving message and one that our communities desperately need.
It's brilliant in its simplicity, Doctor, and we thank you for the effort once again. But tell us now, what are you seeing today at your hospital in New York, which has been so hard hit by this virus, the difference between now and just a few weeks ago when New York was at its peak?
Well, I can tell you that a few weeks ago it was mayhem. It was tragedy piled upon tragedy. It was heartbreak piled upon heartbreak. It was pandemonium, and it was exhausting. You know, I ran one of the COVID-19 units at our hospital, and I've never seen such human, spiritual, and physical devastation. The emotional component was also hard to bear. We saw a lot of patients die. We saw couples devastated, whole families dying. I in particular had a husband and wife couple, both with COVID-19, and the wife was affected much more severely than the husband, and he ended up watching his wife die. And I was able to put them in the same room because initially they were separated, you know, due to just the contagiousness. We try to isolate all our patients. I managed to get them into the same room so that he could be with her as she passed. And the stories are just so heartrending. But thankfully, due to social distancing, due to staying at home, due to wearing masks, and I have to applaud my New York City colleagues and community members for really adhering and complying with these safety precautions, because by doing so, by staying away from this virus, we have seen the number of new cases come down, the number of hospitalizations come down, and we're even seeing the number of deaths come down. So we are cautiously optimistic that if we continue to adhere to these safety precautions, we will reach low transmission rates that will enable us to begin slowly reopening.
All right, Dr. Olajide Williams, Hip Hop Health, thank you so very much for all you and your colleagues do on the front lines. We want you all to be safe, please, and keep doing what you're doing. We'll keep getting the message out there.
Thank you so much.